hub is to provide a facility where manufacturers from low and middle income countries can receive training in how to produce certain vaccines and the licenses to do so. We believe the mRNA Technology Transfer Hub holds huge promise, not just for increasing access to vaccines against COVID-19, but also for other diseases including malaria, tuberculosis, and cancer. I was honored to have the opportunity to visit the hub 2 weeks ago, and it's already producing results, with Afrigen's announcement that it has produced its own mRNA vaccine candidate. Producing mRNA vaccines poses some barriers to low and middle income countries, including their costs, the fact that they require a cold chain that's difficult and expensive to implement. It also requires a skilled and trained workforce. Currently, biomanufacturing training facilities are located mainly in high-income countries and operate on a fee-based system, putting them out of reach for many lower-income countries. That's why today, WHO, the Republic of Korea, and the WHO Academy are announcing the establishment of a global biomanufacturing training hub that will serve low and middle income countries that wish to produce not just vaccines, but other biologics, including insulin and monoclonal antibodies. The government of the Republic of Korea has offered a huge facility that conducts biomanufacturing training locally and will expand its operations to accommodate trainees from other countries. The WHO Academy will support these efforts by helping to develop a comprehensive curriculum on biomanufacturing. The first two countries to join the mRNA Technology Transfer Hub last year were Argentina and Brazil. Companies from both countries are already receiving training. Last week, we announced the first 6 African countries that will receive technology to produce their own mRNA vaccines: Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia. Today, we're announcing a further 5: Bangladesh, Indonesia, Pakistan, Serbia, and Vietnam. That brings the total so far to 13, and we're in discussion with several other countries. We're honored to be joined today by 4 countries that are now participating in the hub and will start receiving training from next month. But first, it's my honor to welcome His Excellency Dr. Kwon Deok-chul, the Minister of Health and Welfare of the Republic of Korea. Mr. Kwon, welcome, and thank you so much for your government support for this very exciting new initiative, and you have the floor.
Mr. Kwon, we think you're muted. Can you unmute yourself?
Okay, now begin again. Dear Excellencies and colleagues, it is a great honor for Korea to be nominated as the WHO's Global Biomanufacturing Workforce Training Hub. I am overwhelmed with a sense of excitement what this means to Korea. Korea takes this chance to fulfill its important role with a sense of duty and high resolve. I convey my deepest sense of gratitude to WHO. Together with the WHO and the international community, Korea will spare no effort in training personnel from low and middle income countries to build and strengthen their own vaccine and biologics manufacturing capabilities. For Korea to be nominated as the Global manufacturing workforce training hub holds particular significance. Just 60 years ago, Korea was one of the poorest countries in the world. For decades, the impoverished and weak public health system used to be one of the biggest problems that the Korean government had to solve. With the help and support of the WHO and the international community, Korea has transitioned into a country with a strong public health system and a country that exports medical essentials such as vaccines and biologics. Korea deeply cherishes the solidarity that the international community has shown us during our transition. Now, Korea is ready to stand in solidarity with LMICs to share our experience. Starting in July this year, Korea plans to train 370 professionals from Africa, Asia, and South America in the field of the vaccine and biologics. And we plan to accommodate more trainees in the future. Korea will strive to support all in strengthening their capabilities to manufacturing vaccines. The continuing challenge with the coronavirus pandemic humbly reminds us of the critical needs for nations to collaborate and to stand in solidarity with one another in order to overcome this global crisis of public health system. By sharing the lessons Korea has learned from our own experience in the past, Korea will strive to support the LMICs in strengthening their biomanufacturing capabilities so that we could pay our way together towards a safer world during the next pandemic. Korea looks forward to you all for your continued support and interest. Thank you.
감사합니다, Minister Kwon, and thank you once again for the Republic of Korea's generosity in supporting this effort. And now the 4 countries that will receive vaccine technology from South African hub and receive training to produce it. We begin in WHO's Southeast Asia region with Indonesia. It's my great pleasure to welcome Her Excellency Retno Marsudi, the Minister of Foreign Affairs in Indonesia. Mr. Marsudi, thank you for joining us today and welcome, and you have the floor. Terima kasih.
Well, thank you very much, DG Tedros, colleagues, ladies and gentlemen. It is an honor for me to be back in Geneva and have meetings with DG Tedros, KF Gavi, and COVAX. And I'm very glad to participate in this press conference before flying back to Jakarta. Colleagues, Indonesia is one of the countries that continuously support vaccine equity, including through transfer of vaccine technology and know-how to developing countries. Indonesia's G20 presidency also includes this issue as one of the priorities. Today, I'm very pleased to hear that Indonesia and Biopharma have been trusted to be one of the beneficiaries for the mRNA vaccine technology transfer. Biopharma is the largest vaccine manufacturer in Southeast Asia, with production capacity of more than 3.2 billion doses per year. It produced 14 types of vaccine and has exported to more than 150 countries. Indonesia's ability to harness the mRNA technology will serve the regional's need for the mRNA technology-driven vaccine and therapeutic development and manufacturing. This transfer of technology will certainly contribute to equal access to health countermeasures, thus helping us recover together and recover stronger. This is the kind of solution that developing countries need, a solution that empowers, a solution that strengthens our self-reliance, a solution that allows us to contribute to global health resilience. Colleagues, This kind of cooperation needs support from all of us, and we do hope that this cooperation could narrow vaccine inequality. Our time is short. That is why our work to end this pandemic needs to be effective, so the benefit of our collaboration becomes infinite. Together, we show multilateralism delivers and brings benefit to our people. Recover together, recover stronger. I thank you.
Recover together, recover stronger. I fully agree, Minister Retno, and terima kasih. And we look forward to continuing to support Indonesia on this journey, and so that Indonesia can support the world. So terima kasih, and thank you so much for joining us in person. That's a great honor. And I understand you have other commitments, so thank you so much for joining us today, and safe travel back home. Shifting now to the Americas, it's now my honor to welcome Dr. Carla Visotti, the Minister of Health of Argentina. Your Excellency, welcome, and you have the floor.
Muchas gracias, doctor Tedros, estimados colegas. Es un honor para Argentina haber sido seleccionada junto con Brasil como los centros regionales para el desarrollo y producción de vacunas de ARN mensajero para nuestra región, para América Latina, con el objeto, por supuesto, de luchar contra la COVID-19, y no solamente por eso, sino también para otros futuros desafíos relacionados
Infectious disease-related challenges. Accordingly, it's a pleasure for me to join you today virtually to share this important announcement about recipients in other parts of the world. We would also like to congratulate them. We're happy to be working together to tackle this enormous challenge. We are convinced of the decisive role that a diversified pharmaceutical manufacturing capacity has to promote equitable access.
Rezultatom za nas je, mi smo veoma ponosni što je jedna od argentinskih kompanija odabrana da bude proizvođač vakcina pomoću ove tehnologije. I
el apoyo y el compromiso del Estado argentino
argentinska država se obavezala da što brže i što bolje omogući transfer ove tehnologije i započne prenos vakcina.
Y en el contexto de la pandemia de COVID-19, un pilar clave no solo para salvar.
U kontekstu COVID-19 vakcine su ključni ne samo za spašavanje života, već i za ekonomski i socijalni brži oporavak i služi na korist svih naših naroda. Uprkos velikim poteškoćama koje smo imali u našem regionu što se tiče
South America is the region in the world that has one of the highest levels of vaccine coverage, and in the region of the Americas, Argentina has received over 110 million doses of vaccine, and we've managed to reach almost 80% vaccination coverage. And we've therefore surpassed the objective set by the WHO for June of this year. That's halfway through this year. In our country, we've managed to provide over 48 million first doses and 16 million booster doses. We've also received almost 100 million doses all over the country. We've also provided over 5 million doses to other regions and continents around the world. And it's very important to create this virtuous circle and promote solidarity to make progress on vaccinations. As a result of our vaccination campaign in our country, which has been carried out over 3 years, we've managed to improve the epidemiological situation and continue working on other areas related to health strategies. Colleagues, Latin America does have the necessary capacity to improve local production and increase access to vaccines. It also has strategic inputs of other types. And it's very important to show how other countries, regions in the world can help to contribute towards achieving global challenges. The public sector and the health sector in Argentina are very ready to overcome these challenges. And of course, we're very happy to have the technical support from the WHO, and particularly with regard to the regional offices, PAHO, and we've also got the international expert community, we've also got a network of the private sector experts. Of course, if we want to achieve better health results and outcomes all over the world, and to be better prepared for future health emergencies, we need to make sure that we can break the current cycles that are in place and promote equitable distribution of these products. Thank you very much, and I'm pleased to be working with you.
Muchas gracias, Minister Visotti. Now to Europe, and it's my privilege to welcome Dr. Latibor Lončar, the Minister of Health of Serbia. Your Excellency, thank you for joining us today. Welcome, and you have the floor.
Imate riječ.
Zdravstvene organizacije, uvažene kolege, poštovani predstavnici medija.
Dear Dr. Tedros, dear colleagues, dear representatives of the media, the Republic of Serbia has expressed interest in participating in the project, WHO project, dealing with the transfer of mRNA vaccine production technology. The efficiency and flexibility of the Serbian system demonstrated in the previous period through prompt diagnostics, prevention, treatment, distribution of vaccines, medication, and medical devices have proved as sufficient and requisite precondition to continue with further development in this domain. By participating in this project, national production capacity will be established, aiming at improved access to vaccines produced through the application of the most modern technologies, contributing as well to the overall increased readiness for the potential pandemic response. By forming the regional center, so-called mRNA hub in the Republic of Serbia, we will be able to fulfill the requirements of both national and international health systems. The support of the World Health Organization in this process is of essential importance for the development of continuous, safe, and modern production of vaccines. The development of new technology implies the development of professional knowledge of Serbian experts and training of new young staff as the absolute national priority. During the pandemic, we have learned that introducing new technologies into research and making decisions based on evidence are the most essential factor for effective response to all public health threats. I would like to conclude by expressing gratitude to the World Health Organization for its continuous support, since I'm convinced that we shall continue with excellent cooperation in this area as well as other public health areas. My best wishes from Belgrade, and I'm looking forward to meeting you soon in person here in Belgrade. Thank you.
Hvala, Your Excellency, thank you once again for being with us today. Finally, to the Western Pacific, where it's my great pleasure to welcome His Excellency Dr. Nguyen Thanh Long, the Minister of Health of Vietnam. Your Excellency, thank you for joining us today and for Vietnam's participation in this exciting new initiative. You have the floor.
Ladies and gentlemen, first of all, I would like to congratulate WHO and mRNA vaccine technology transfer hub on the historic achievement made in the last couple of months, including the selection of beneficiary country of the mRNA vaccine technology transfer, the establishment of the global biomanufacturing workforce training hub in the Republic of Korea, which is also announced today. I also recognize that the MPP and the ICT provide key partner in the initiative. On behalf of the government of People of Vietnam, I'm very glad to express our sincere thanks to WHO for selecting Vietnam to receive the mRNA vaccine technology through the WHO mRNA vaccine technology transfer initiative. This shows that WHO highly value our capacity to master the technology and produce the vaccine in large scale is a high quality. The government of the Ministry of Health of Vietnam are committed to supporting and creating favorable conditions for domestic vaccine manufacture in receiving the mRNA vaccine the technology. As you may know that we have had a lot of experience in vaccine development over the past decade. Our NAR has also been recognized by WHO. We believe that in participating in this initiative, Vietnam will produce the mRNA vaccine not only for domestic consumption, but also for the other countries in the region and the world, contributing to reducing inequality in access to vaccine. The mRNA vaccine technology is an advanced technology that allows updating the vaccine to adapt to new variant more easily and be produced in large quantity. The groundbreaking technology not only helps control the COVID-19 pandemic, but also better respond to future pandemics. Therefore, Vietnam hopes to continue receiving support from it to collaborate with WHO and partner to go one step further in this initiative, thereby contributing to strengthening production capacity of vaccine in the region, contributing to activity to ensure international and regional health security. And thank you very much.
Shin, come on, Minister Nguyen, and thank you once again to you, to all our guests for joining us today. We look forward to working with all of you in the months and years ahead. Our vision is that this initiative will pay dividends for many years to come and help to save many lives, because we believe it's a strategic solution to the problem of equity we're facing now. Margaret, back to you.
Thank you very much, Dr. Tedros and distinguished panel. We will now open the floor to questions from the media. Please try to focus your questions on the subject, technology transfer and training. But we do have our usual team of WHO experts here to ensure you get the best and most complete answers. We also have Dr. Agnès Buzyn, our Executive Director of WHO Academy, who can tell you more about how WHO will be supporting the curriculum for the biomanufacturing training. First question goes to Donato Mantini from the Financial Times. Donato, could you unmute yourself and ask your question?
Hi, good morning, good afternoon. Thank you so much for the opportunity. I have two questions for you. So I understand this may be difficult at this stage, but can you quantify the impact this will have concretely with any numbers, if that's possible? Such as, this will help make XX million doses of vaccine or XX million vials of insulin. Obviously, I understand why this is good news and big news, but I think it would help to provide context to our readers. And the second question is, critics will say this is great, but perhaps a bit late. So did you try to do this earlier in the pandemic, and did you face resistance from certain sectors, such as the industry? Thank you very much.
Thank you, Donato. I think Dr. Sumia will start and others may join.
Yes, thank you, Donato, for that question. Others may certainly like to add. So, as you remember, right from the beginning of the pandemic, the WHO had recognized that the vaccine inequity or inequity in access to health products in general is a real threat and a real possibility that we needed to get ahead of. And this is why the ACT Accelerator and the COVAX facility and partnership was created specifically to address the issue of vaccine inequity. However, because of the fact that vaccines and in fact other health products, the manufacturing of these products is concentrated in some regions of the world what we saw happening was that other regions of the world which did not manufacture products actually got to into the back of the queue, and they had to wait till the regions that were manufacturing had actually supplied their own populations and then were able to spare doses. And we made a call very early on. If you remember, the DG had called for the motion at the WTO on the TRIPS waiver to go ahead, that countries should agree to do that. We had also called upon companies to share their know-how technology, either through voluntary licensing or through these multilateral mechanisms that exist. We have the medicines patent pool that does exactly that, and has happened with some drugs, but we have not seen that happen with vaccines, except for a couple of companies that did go out and do a lot of voluntary licensing. But and we saw clearly that it wasn't enough. In the whole of 2021, we were facing the supply-constrained situation where countries were unable to scale up their vaccination programs because of unpredictable supplies, and often supplies that came with short expiry dates. So this concept was launched in April of last year, and I think has moved fairly rapidly. But of course, it's complex. It requires not only developing and transferring a new technology, but it also requires a building of facilities that can handle this type of expertise and training people to do this. So we're looking at this as a medium to long-term initiative, not, as you said, necessarily solving the problems in 2022. We know the pandemic hasn't ended. We know that there may be ongoing demand for vaccines. So this project may still satisfy the demand in the future and make perhaps better vaccines with better properties available as we move ahead. As you know, one of the things we're trying to do here is to promote more R&D and sharing of information and knowledge with these networks of centers that are going to be set up, because mRNA technology is new and currently comes with a lot of limitations in usage, especially the cold storage conditions. So there could be game-changing technologies in the pipeline where mRNA could be stored at 4 to 8 degrees, for example, and also be made in ways that make it more affordable to produce these vaccines. And finally, I think this technology and this whole process of empowering and building capacity in places around the world will not only enable more work on vaccines of other public health importance, like TB, like dengue, like chikungunya and other diseases, but also serve, as our backup plan for the next pandemic, so that if, and let's hope there isn't, but if there is another pandemic with another pathogen, there will be all of these distributed manufacturing sites that are capable of absorbing and quickly scaling up mRNA, so that in any one lab in the world were to develop a vaccine for that new pathogen, then within a few weeks or months, we could have capacity, we could have manufacturing scaling up very rapidly. And so I think that really is the goal with which we approached this, not necessarily to solve the problem of today, which needs to be solved basically by equitable sharing of vaccines and making sure that we address also some of the absorption constraints, the delivery constraints that countries are facing. Thank you. I wonder if anyone would like to add to that.
Dr. Mariangela, Shamal, who's online, has something to add on this. Dr. Shamal, over to you.
Thank you very much, Margaret, and thank you, Donato, for the question. Actually, I want to touch on the biomanufacturing hub and the importance it has. We don't have yet quantified the issue on diabetes like you mentioned, but let me say that the biomanufacturing hub in Korea, in the Republic of Korea, is especially important for us to deal with problems that are beyond COVID, right? And also, let me talk a little bit about the issue that we are talking about the biotherapeutics, right, for COVID. We did speak with each of the manufacturers of the biotherapeutics. There are some of them already in WHO's guidelines. And there's always an issue that's mentioned when we're talking about IP or technology transfer. There's always the issue of how, but the quality manufacturing capacity is not available elsewhere. So let me say that the biomanufacturing hub, as a training hub, working with the regulatory and the the good practices in the manufacturing being in Korea will be extremely helpful for WHO and the world to tackle chronic diseases like diabetes. There is an increasing need for monoclonal antibodies, for example, for cancer treatment, for immune diseases, and so on. So we are talking about COVID, but we are talking also beyond COVID. And no, we did talk with the manufacturers, the current manufacturers, and no, there was no interest in tech transfer. So that's why this is being organized now and has a significant importance for the future on the access to affordable and safe treatments. Thank you.
Dr. Buzyn, would you like to add anything on the importance of training and the difference this is going to make?
Yes, thank you very much. First of all, we are really looking forward to work with the Korean Global Biomanufacturing Workforce Training Hub, because we think that there is some place for in-person training, but also for hybrid experience with digital training to enhance the capacity building of healthcare workforce to deal with those issues of biomanufacturing. The role of the WHO Academy in this hub will be, of course, to establish the entry requirements for the learners, to define the curriculum pathway, to be able to deal with those issues, and of course, to give assessment and credentials to the learners to be sure that they gain some new skills, new competencies to ensure good quality biological products at the end. So we are really willing for this collaboration. Thank you.
Thank you so much for all those comprehensive answers. The next question goes to Preeti Patnaik from Geneva Health Files. Preeti, unmute yourself and ask your question.
Good afternoon. Thanks for taking my question. Can you clarify whether and when other companies in other Asian countries, including, say, Chinese and Indian companies, will be able to participate in regional manufacturing activities around mRNA vaccines, because clearly these countries do have, early infrastructure to produce these vaccines. Because it was previously indicated that some exceptions could be made while issuing licensing from the hub to exclude potentially big developing countries. Can you clarify if that's the case? Thank you.
Thank you, Preeti. Dr. Martin Frieda will answer your question.
Okay, thank you, Preeti. A very good question. What we are trying to avoid is to have excessive competition within countries, or to be leading to excessive competition. And so countries such as India and China, which have already, they've got some mRNA vaccine candidates already under development. And also we received multiple requests from within those countries. So we are currently working with the national government to identify what they would like us to be supporting within the country. But this will still take some time as we work out what is the most appropriate response for each country. Thank you.
Thank you, Dr. Frieda. I'm looking around the room. I think that's fully answered that question. So the next question goes to Andy Hoffman of Bloomberg. Andy, please unmute yourself and ask your question.
Thank you. Good afternoon. Thanks for taking my question. Just so I understand that, focusing on COVID-19 mRNA vaccines, the vaccines that will be produced under this program are the ones that you're developing from the mRNA hub in South Africa. How long will it take for that formula to be developed so it will be ready to be a vaccine and then be approved by various health authorities, including the WHO, as a vaccine? And have you completely abandoned working with and getting technology transfer from the major mRNA vaccine producers, Pfizer and Moderna? Thank you.
Thank you very much. This is Dr. Sumya Swaminathan. We'll start the answer on this one.
Yes, I'll start. I'm sure Martin would like to add as well. So to the first, I'll take your second question first, and that is, have we abandoned the possibility of working with the companies that have proven technologies? And we have two, the BioNTech, Pfizer, and the Moderna vaccines. No, we have not, and we would very much welcome a partnership with them, because as we were describing, the development from scratch of a vaccine does take time. And while Afrigen has, in a very short period of time, working with the academics in South Africa, been able to develop an mRNA vaccine construct based on publicly available information, this is a new construct, and therefore it will have to go through the entire clinical development program, starting with animal studies and then go through clinical trials, which means that it's not going to be really available as a vaccine that before the end of 23 or more likely 2024. This timeline can obviously be shortened considerably if a known technology or known vaccine with proven efficacy and safety were to transfer their know-how and provide technical assistance to the hub and to the spokes, which means it's just a question of really producing that vaccine at the quality standards. And I think the South African hub has shown that it's possible to do it. So I think it's a myth that low and middle income countries cannot produce mRNA vaccines. We know now from the landscaping we've done that there are several existing sites around the world that are quite capable of producing these vaccines. So yes, I think the WHO is very open and committed to working with partners. There are a number of other companies, mostly biotech companies, smaller companies, again from around the world, that have